The pain in their eyes. A clear testimony of the life and death struggle. Some of the patients admitted at the special facility set up to deal with the outbreak of cholera that has ravaged the vast Mandera County. With the cholera death currently standing at 18 and over 700 people infected with chikungunya virus in the county, the Ministry of Health now says the desperate health crisis in the county is due to the poor response by the county government and the misdiagnosis of the chikungunya for malaria.
There was a delay in diagnosing this particular problem because people were treated for malaria when actually they didn't have malaria. And therefore, it goes back to the whole issue of our surveillance system on how we need to strengthen it.
Mandera Senator Bilokero says close to 75% of the residents of the county have been infected, including the Governor Ali Roba and a member of the National Assembly.
The latrine coverage in Mandera, we were told there when the minister went, is about 34%. And the piped water supply is only 2% in the whole town, a town with over 250,000.
This as the Kenya Red Cross embarked on a campaign to treat all water sources in the county, an exercise carried out twice a day from the county's main water supply and extended to all boreholes within the community to check the spread of cholera.
We are chlorinating shallow wells twice per day, 5:30 a.m. as early as 5:30 a.m. every day, and also 4 p.m. every evening.
The water sources in Mandera are really open shallow wells. Means of transporting and harvesting of this water has been use of water bowsers, use of donkey carts, so there is also contamination.
According to Mandera County Chief Officer Health Mariam Dahir, the county government has put stringent measures in place to curb the spread of the disease. But now the county is at risk of yet another outbreak of yellow fever, which is causing havoc in neighboring Ethiopia.
We have got over 100 teams, 100 different teams doing health promotion throughout Mandera East, where the outbreak is.
Concerted efforts in combating the spread of both cholera and chikungunya in the county has seen a team comprising of volunteer doctors and nurses pitch tent in the county. A move that has seen a huge number of patients receive medical care at this makeshift treatment center, where high standards of hygiene is paramount and applies to anyone getting in and out of the camp. The war against the double outbreak of cholera and chikungunya disease is expected to continue, with the county government hoping to contain the outbreak within a period of 2 weeks. This medical camp hopes to alleviate the suffering and stem the spread of cholera disease. Doctors here say by confining patients in this place, they are nipping the disease while at the same time offering the much needed treatment care. Gloria Milimu, K24, Mandera County.